More breaking news coming in, this time from South. Tamil Nadu Health Secretary has spoken to NDTV on the CAG flagging less inspections and drug sample collection in the state of Tamil Nadu. The Health Secretary of the state has asked EPS to respond to the CAG findings on shortfall in inspections and sample collections between the years 2016 and 2021. The central drug inspectors too had failed, remember, to conduct mandatory inspections every 3 years at this Tamil Nadu plant where the cough syrup has turned out to be spurious. Sam Daniel now joins me live. Sam, just take us through the details you have for us on this of the Tamil Nadu Health Secretary speaking to you on this big breaking news.
A day after CAG details became public that there were severe shortfall in terms of inspections and in terms of collection of drug samples by authorities in Tamil Nadu between the years 2016 and 2021 to the extent of 40% in the case of inspections and 54% in the case of drug samples collection. The Tamil Nadu Health Minister has blamed it on the then ruling AIADMK to respond. In this case, Mr. EPS, who was the Chief Minister then. But for a specific question whether the Tamil Nadu government now, the ruling DMK, had failed to act on the flagging by CAG last year, the Minister and the Health Secretary say action was taken, but they concede lapses over the last 2 years in terms of no inspections done at this particular plant. The cough syrup which were made there has now led to the death of at least 20 children in Madhya Pradesh. And this is what Dr. Senthil Kumar, the Health Secretary, had to tell me. Did the government fail to learn lessons after the CAG report, sir?
It is periodically inspections are being done. So in 2021 and 2022 inspection has been done by the state drug authorities on this firm, and follow-up action including penalty have been levied on this. So the last 2 years there was lapse, and for which action has been taken on the...
This was flagged by CAG report last year. Yeah. Didn't we learn lessons and intensify?
Government has been conducting periodic inspections and taking follow-up action. Other places, intensive inspections have been already ordered, and they are already doing them.
What specific violations have come to light, sir, from this plant, Sresan's plant?
A number of violations have been reported, and follow-up criminal action has...
Around 300? Around 300?
So has the license of
shortage of inspectors a problem, sir? Shortage of inspectors?
No. Recently, government has also recruited almost 90 drug inspectors for the drug report.
And in related news, both from Madhya Pradesh as well as Rajasthan, NDTV has accessed the CAG reports on this matter. In an important report table in the Madhya Pradesh Assembly on the 18th of December last year, the CAG had highlighted the mismanagement of important drug stores in Chhindwara district. That's where, viewers remember, 20 children have lost their lives. The report specifically said that the physical verification of the stores was not being carried out even once in Chhindwara Institute of Medical Sciences during 2018 and 2022. Now moving to Rajasthan, the Rajasthan CAG report, as per the report of 2016 to 2022, has also stated, especially in the year 21 to 22, that drug controllers should have done 21,840 inspections, but they only managed about 16,748 inspections, which is a shortfall of close to 5,000 inspections. Joining me live, Harsha joining me from Rajasthan at this point, from Jaipur, and Anurag joining me live from Bhopal. Harsha, coming to you first, lapses and more lapses indicated by the CAG. This was a complete disaster in terms of an issue that could have been corrected before the deaths of these children, especially in Chhindwara.
Well, in Rajasthan, definitely we have said that about 4 children is the figure that we have, which the government is refusing to accept, have died due to dextromethorphan hydrobromide. Now, ironically, dextromethorphan hydrobromide has actually been cleared by the lab tests. But I think what the CAG report is doing is raising a larger question about the way the health infrastructure works. The health infrastructure is clearly overburdened and not able to cope with the kind of work that it should be doing. So if you look at specifically at the audits that the drug inspectors should have been doing, there is a 23% shortfall here. And if I just wanted to make sense to these tables, if you just connect it to tribal areas and to districts, to tribal areas especially, and to districts where, I'm just looking at that figure, to tribal areas and districts where the health infrastructure is even more crumbling. Now, if you look at Banswara, there's a 67% shortfall in the number of inspections that should have happened. So that means even half the inspections that should be happening did not happen. Now, remember, in Banswara, we reported 8 children who had not died, I beg your pardon, but who had fallen sick because they took dextromethorphan hydrobromide. Now, the problem is that pharmacists don't know that you shouldn't be giving it to children more younger than 2 years, in fact, younger than 5 years. So now the government is training health workers, now the government is sensitizing pharmacists. The problem is this CAG report should be looked upon as a report that points to the larger problem of the crumbling health infrastructure.
Absolutely, and the lapses really. And I'm going to take that point to Anurag as well. Anurag, a part of that report that you have sent to us also talks about how specifically in Chhindwara inspections were not carried out. Can you elaborate on that? That's so important given the deaths that we've seen. The maximum number of deaths due to this cough syrup from Chhindwara.
See, we have only 80 drug inspectors for the entire state of Madhya Pradesh and only 3 labs for the testing of drugs. So if you go by the figures, we have a total capacity of, testing 6,000 samples in a year, and the pendency is 5,500. So far they have taken 19 samples of the recently, seized Coldrif and Nextron DS. So it will take another 14 months just to test these, samples which were seized from Chhindwara and adjoining areas. If you go by the CAG report that was tabled in the Madhya Pradesh Assembly, which says not only in cough syrups like Coldrif, but you can just imagine the poor health infrastructure and the mechanism here which is working in Madhya Pradesh, because CAG's report reveals that Madhya Pradesh Public Health Service Corporation continued to purchase and distribute, this was in the government hospitals by the way, that were explicitly banned by the government of India for human use, putting human health at serious risk. Between 2017 and 2022, the corporation entered into rate contracts worth rupees 1.5 crore and for procuring these banned drugs by the government of India, and 29 lakh through local tenders at the district levels, bringing the total value of prohibited drugs purchased to close to 2 crores. And the CAG has also warned that reckless procurement of banned drugs violates national drug laws and endangers millions who depends on the public health care for safe and affordable medication. So this is the status of public health and the drug distribution inside the government hospitals, flagged by none other than the CAG.